Good morning, everyone. Breathing is an automatic process, yet it involves a complex interaction between the lungs, heart, and nervous system. When this process is disrupted, understanding the cause and the appropriate intervention is crucial. Today, let's explore key concepts in respiratory emergencies, including anatomy, pathophysiology, and essential skills used in treatment. The respiratory system relies on a delicate balance of oxygen and carbon dioxide exchange. This balance is regulated by the brainstem, which detects changes in blood gases and signals the body to adjust breathing. For most people, rising carbon dioxide levels trigger breathing. However, in patients with chronic obstructive pulmonary disease, or COPD, prolonged exposure to high CO2 alters this response, making them rely on low oxygen levels, a mechanism called the hypoxic drive. Administering too much oxygen to these patients can suppress their breathing. Another critical concept is ventilation. The adequacy of breathing is determined by both rate and volume. Adult ventilation rates should provide enough air exchange without causing complications. Hyperventilation, for example, reduces carbon dioxide levels too quickly, leading to dizziness, muscle spasms, and in severe cases, loss of consciousness. On the other hand, conditions like congestive heart failure, CHF, can cause dyspnea, especially at night, due to the fluid buildup in the lungs, making breathing difficult. Recognizing these signals is essential in determining the appropriate treatment. Lung sounds also provide valuable clues about the respiratory conditions. Wheezing, a high-pitched whistling sound, is common in asthma and COPD due to narrowed airways. Crackles or rales indicate fluid in the lungs, often seen in heart failure. Stridor, a harsh sound during inspiration, suggests upper airway obstruction, such as anaphylaxis or croup. These sounds guide healthcare providers in diagnosing and managing respiratory distress. In emergency situations, understanding airway management is vital. Tracheostomy tubes, used for patients who require long-term ventilation, can become obstructed, requiring suctioning techniques to clear the airway. In severe cases, tension pneumothorax, a condition where trapped air in the chest compresses the lungs and heart, must be relieved immediately with needle decompression. To stabilize respiratory emergencies, healthcare providers use various techniques. Administering respiratory medication like bronchodilators help open the airways, while bag valve masks, ventilation supports breathing in patients who cannot do so effectively. Assessing the adequacy of respirations ensures that the patient is receiving enough oxygen to sustain vital functions. In summary, respiratory emergencies require a deep understanding of anatomy, physiology, and pathophysiology. By recognizing the signs of distress, interpreting lung sounds, and applying the right interventions, health professionals can make life-saving decisions. Breathing is essential. So is knowing how to protect